Okay, so introductions to the primary eye care examination, chapter 2 by David E. Elliott. Now, this chapter discusses the format of primary care eye examinations and patient-centered optometry and communication skills, the case history, bibliography, further reading, and references. So I think the important section here is patient-centered optometry skills and communication skills and case history. So let's go to that chapter section. Okay, so I just went past. All right, so recording. So says here in this description of clinical procedure in the following chapter, a subsection on recording is included in each case. It is essential that all test results, including results from case history, are recorded. If they're not recorded, subsequent legal analysis of record will conclude that they will not perform. All right, so 2.2 patient-centered optometry and communication skills. Communication with patients is important. It's the evidence from the medical literature that patient satisfaction is strongly linked with good communications. So good communications are able to make a patient feel relaxed and that they have been listening to, and that the problem they have with their eye or visions have been fully understood, and that all appropriate tests have been performed. Let's go. And this is the clinical records of fictional patients here. So we got the chief complaint at the top there, Ocular Health, family history, general health, family medical history, and patient drives or not. And then you do your preliminary testing, which include your distance vision, aided or unaided, and near vision, aided, unaided. Do your muscle balance, cover tests, conversions, your PD, and your motility. Then you start do your refractions here, objective, and then subjective refractions, and your reading at what distance, intermediate at if applicable. Then you check the binocular visions, so muscle balance. Then you have an ocular health sections, which you check the eye pressure, your pupils, the anterior angles using the Van Herrick method. Then using slit lamp to check the anterior surface of the eye. You got your this one. Say there's a little bit of a small pink oleculae in nasal, right and left, and the CD ratios are healthy. CD ratios are within normal, healthy neural rim as well. And any supplementary tests, visual field, and a summary of your finding, what the problem is, the diagnosis. So this patient has presbyopia, and the plan is to get multifocal PLs. And this is the final RX. RX advice needed for near vision tasks only, no need to use with PC. Okay. Okay, so so provide information regarding test news, diagnosis, prognosis, and management plan. So this said, provide an explanation of each test that you use in an eye examination. Suggested information in layman term is provided for each test described in a later chapter. Now, patient expects you to provide information about the cause of their visual problems, the prognosis, and any management plans, all in a clear non-technical language. And contact lenses is common but is proved by a better patient-practitioner relationship. So 1. Diagnosis. At the end of the examination, you must discuss your findings, particularly those that related to the patient's chief complaint and other secondary complaints. Give a full explanations of the diagnosis in layman terms, unless your patient works in the medical field and has some knowledge. It can be very useful to have a cross-sectional diagram of the eye to help you in the explanation. Make sure you go back to the case history and try to explain each of the patient's symptoms. So it is generally best to discuss your finding in order of the relative importance of the problem to the patients rather than your own opinion of the relative importance of the diagnosis.